is Brittany Thomas. I'm a nursing student at Bluefield State College in the BSN program. Today, I'm presenting to you an ethical dilemma. During the Obama administration, same-sex marriage was legalized, which brought a new sense of equality to the lesbian, gay, bi, and transgender community. Through years of struggle, it was finally recognized. But as you will see in the following case, there are still struggles for LGBT members. Equal rights and ethical rights are absent in this situation. In February of 2007, Janice Langbein was denied the right to visit her same-sex partner in the intensive care unit at Jackson Memorial Hospital in Miami, Florida. Langbein and her partner, Lisa Pond, were vacationing with their 3 children when Pond suffered an aneurysm. At the hospital, nurses and doctors refused to let Langbein or her children see Pond, and they did not provide them with adequate updates on her condition. Pond eventually slipped into a coma and died while her family members were trying to persuade administrators to let them into her room. This brings to light the following question. Should LGBT partners be allowed next of kin status for their hospitalized loved one? My answer to this question is yes. As a member of the LGBT community, I believe that we should receive equal status as next of kin, just as a heterosexual couple receives this same statute. I believe strongly that next of kin status should be a broader term in the event of hospital visitation rights. This topic is relevant to nursing because many families need and want security, equality, and recognition. So if they are in a horrible situation that their family member is in the hospital, they will not be denied the right to see their loved one. Who all are against this topic? The opposition to next of kin statute are those who do not support the LGBT equality and community, and they still have a legal view of next of kin status. Next of kin status is unofficially defined as a blood relative or a heterosexual spouse. In the United States, it is a legal term where a precedence is established and as follows with heterosexual spouse, children, parents, siblings, grandchildren, and etc. There is no defined role for same-sex partners. As in the case of Langbein and Pond, it is possible that next of kin could be denied their rights, and state statutes vary and could be denied in LGBT cases. After that case, President Barack Obama issued a presidential memorandum on hospital visitation that called for appropriate rulemaking to ensure that hospitals that participate in Medicare or Medicaid respect the rights of patients to designate visitors. The memorandum recommended that U.S. Department of Health and Human Services detail guidelines for hospital visitation that prohibit discrimination based on race, color, national origin, religion, sex, sexual orientation, gender identity, and disability. The regulations prohibit these types of discrimination in hospital visitation and make it clear that designated visitors should be permitted access to patients regardless of whether they have legally recognized relationships. These regulations also require hospitals to have written guidelines and inform patients of their visitation rights. According to the new regulations, all visitors must receive equal visitation privileges regardless of whether they have legal or a biological relationship with the patient, as long as the patient wants to see the visitor, or if the patient is unconscious, the visitor must get equal visitation privileges if the patient would want to see the visitor. Hospital staff may not invoke their personal religious beliefs in order to deny visitation rights or same-sex or unmarried partners. In most situations, all a patient support person must do is state that he or she is the patient support person, and hospital staff will be required to respect that. No proof is required. The only time hospital staff will be allowed to require proof is when there is a conflict between 2 or more persons claiming to be the rightful support person. Proof that partners may share a home or finances or written documentation of a committed relationship, even if it's not legally recognized as an advance directive, all may be sufficient forms of proof of support person's status. In these situations, hospital staff will have to resolve the conflict between individuals claiming to be the appropriate support person. Although this was a great improvement, it still still hasn't provided the protection that the LGBT community needs, as shown in these two examples. A patient was in the hospital, and his partner, Mr. Gorley, was removed from the bedside, even though he was in a civil union with the patient, and he had a healthcare proxy for visitation. When family members of Mansell objected to Gorley's visit, hospital staff called the police, who arrested Gorley and escorted him out of the hospital. In another example, Ms. Simonelli was denied visitation rights despite being in a domestic partnership with Brittany Leon, who was having pregnancy complications. Although domestic partnerships grant the same state rights as marriage in Nevada, where they were located, including visitation and medical decision-making, Simonelli was told that she needed a power of attorney to visit her partner. Therefore, Simonelli had to sit outside and wait for updates from the doctors while Leon lost her baby. Situations such as these prove that despite the current regulatory scheme, and even when they have formalized their relationships and completed legal documentation, same-sex couples still encounter discrimination when they most need protection. Healthcare professionals are still being taught a stigma around nursing care for LGBT persons, such as the case of George Dennis. This was a healthcare case study that leans more towards a patient's biological family, when the patient's wishes are for them not to be involved and for his partner to be the medical decision maker. Despite good intentions on trying to let health professionals know how to handle an LGBT case, it still presents itself with heteronormative biases. This case delegitimizes the LGBT family while prioritizing the normative family of origin. How can this be fixed? As nurses, we need to provide non-discriminatory care. We have to be patient advocates and put aside beliefs. We have an obligation to provide the best care possible and honor our patients' wishes. Gender scrutiny and LGBT stigmas should be put aside to uphold the ethical principles of our profession. Advanced healthcare directives are the best way to safeguard LGBT patients. LGBT older adults were given more discrimination and heterosexism demonstrated in society, and those LGBT older adults usually present for treatment late in the disease pathway. They experience poor levels of care while in treatment and are reluctant to adhere to effective follow-up or continuity of care. LGBT older adults usually report poor overall health, higher rates of disability, and greater psychological distress. Advanced care directives would honor the right of a competent individual to control their course of medical care in all circumstances, as well as the corollary right to designate another person to make these choices in the event of an individual's mental incapacity. The right of every American adult to create an advanced directive and the obligation of every hospital to honor these documents is really important. Individuals place tremendous trust in their nurses who will guide their medical care at the time of the individual's incapacity, and advanced directives should be prioritized. Healthcare facilities should also provide training modules to staff that are specifically tailored to the special cases of advanced directives and same-sex couples. Research should also be increased on the LGBT community and their health. Healthy People 2020 has a objective to increase the number of population-based data systems used to monitor healthy people, objectives that include a core standardization set of questions that identify lesbian, gay, bisexual, and transgender populations. In conclusion, it is important to stress that the Equality Act specifically forbids any overt or covert discrimination against individuals and groups because of their sexual orientation or their gender identity. But that doesn't mean that it still does not present itself. Unfortunately, despite increased accountability on the part of many healthcare facilities, discrimination continues to keep same-sex couples apart when they are vulnerable and need each other the most. Regulators and accreditation agencies must take action to enforce visitation rights, protect these families, and ensure that hospital personnel provide responsible services to their patients and loved ones without discrimination. As members of the nursing community, we must work to provide the latest legal and ethical framework to keep all families and patients within their rights. By doing this, we will continue to provide the best and utmost principled care. Thank you.